I'm Vicki Hogarth, and welcome to Southwest Magazine. As New Brunswick grapples with a shortage of family doctors, Dr. Julie Levesque-Taylor of Coastal Communities Health Home here in St. Andrews is here to tell us about innovative approaches that she's already put into practice to take on more patients. Thank you so much, Dr. Julie, for sitting down with me again today.
You're very welcome. I'm happy to be here.
I think you were first here, it must be about 4 years ago, when you relocated from Manitoba to practice here in St. Andrews. I have to ask you how it's gone. I know that you had the pandemic to deal with pretty much as soon as you relocated, but what's it been like moving here?
It's been a wild ride, for sure. So we've made so many advances and changes to the practice since we got here, so I'm super excited to share what we've done.
Let's start by talking about that. You're located right in the building we're in today, where the Wellness Center is located. What are you doing right now? What did you notice in terms of doctor shortages here in New Brunswick when you came here, and what practices that could actually alleviate the stresses we're seeing on the system?
So the first thing I noticed when I got here is that most physicians in New Brunswick, and there are certainly exceptions to that, but most physicians in New Brunswick are practicing in a model where they are the only clinical resource in the team. So your family doctor is the person you go to for your diagnosis of your acute medical issues. They're the one you go to for your preventative care. They're the person you go to for mental health issues, helping you navigate the system, follow-ups from hospital, follow-ups from specialists. It pretty much falls on the shoulders of the physician to deal with all of those issues. And as much as it is great in terms of, from a patient perspective, when one person knows everything about you, for both ends of that relationship, it's pretty magical when you've followed someone for a really long time to be able to say, like, I've delivered your babies and I've taken care of your kids and I've helped you get through a grieving process of, aging parents and all those sorts of things. But the flip side is when you're all that for your practice, what it means is that you can't take on as many people because there's only so many hours and minutes in the day to be able to do all that work. Or you do take on more and more people because there's such need out there because people don't have any resources. And so if you choose to do that as a family physician in the existing model, then what ends up happening is you're short on time in the visits that you have. So you're either shortening your visits to be able to see more people in a day, and you don't get into that in-depth assessment, and you don't get to do prevention, you don't get to talk about mental health, you don't get to talk about, hey, can you afford that prescription for that cholesterol pill or that diabetes treatment that I just prescribed? You don't have time for those sorts of things. Or your patients just can't get in to see you. You can say you have 3,000 patients or 2,000 patients, but if you can't get an appointment for a month or two, you're really no good to anybody because you're not giving them timely access. So there's attachment and then there's access, right? You want both. And in the existing model, what I noticed when I first got here is it's just not sustainable, or it's sustainable on a very small scale. So when I first got here, it was the big fanfare. I sat on the couch, we announced my arrival, everybody was very excited. We took on patients and people came in, they called, they pled their case, they begged, they pleaded, our staff listened. You guys broke our hearts with your stories. We took on the patients that we could. And then there came the heartbreaking moment where we have to start saying no. Again, to be able to be the resource that you want to be to the patients you've agreed to be their doctor. If you can't see them in a timely fashion, there comes a point where you have to say, I'm sorry, I'm not taking on new patients.
And I do have to bring up something significant that's happened for Charlotte County too, which is we've lost 2 doctors in St. Stephen just in 2025 alone that I can think of off the top of my head. And that means, again, thousands of locals. Yeah. My family doctor is based in St. Stephen, so that means a lot of St. Andrews residents too will have lost their doctor and might be looking for a doctor based in their own community. So do you find that you're also, have that challenge of dealing with when a doctor in our community, and it really is our whole region, leaves the community either by passing away or relocating or retiring, do all the doctors just get inundated with new patient requests, and how do you handle that?
You try and handle it as best you can. We did absorb, like there was a physician, for example, that a physician husband-wife team that left the province last year. And so, we had to find happy medium there somewhere. So we said, you know, if your existing family member comes to see me as their physician, and if anybody living under the same roof needs a doctor, lost the doctor because they left, we absorb those people. And even then, it was a squeeze to get them in, but we tried to do what we could. But again, it's like trying to drink from a fire hose. Like, there's so much need out there. Then the way that we practice really needed to change.
Now, I know the province is looking to do that. The goal is by 2030 to have 30 community health clinics across New Brunswick. They promised 10 this year. The one we know of for Charlotte County will be based in St. Stephen, but the model that you are implementing, you can do this on your own. It's something you're taking a proactive approach to. Can you tell us a little bit about what you'll be doing, even though it's sort of outside of the parameters of what the province is doing this year with their promise?
For sure. So since we've been here, it's been 4 years. So we started, and most people probably wouldn't have even noticed the changes in the beginning. So we started with an electronic medical record. So maybe I'll back up a step. The model that we're looking to emulate is called the Patient Medical Home, and it was created by the College of Family Physicians of Canada several years ago, and it's been rolled out to many places across Canada that have chosen to implement the model, including my old clinic in Winnipeg. We were actually the first patient medical home. Like, they do this little newsletter where they announce the successes, and so we were pretty proud of what we had accomplished out in Winnipeg. So I knew how to build this thing. I've lived it. I've evolved it over 20 years in Winnipeg. Why wouldn't I try to bring that here and to create that success here? So that's the model. So if I walk you through the model a little bit, if you want to Google it, it's on the Horizon Health website. You can look it up on the Canadian Family Physician website as well. So it's like a house. The foundation of the house is the infrastructure, right? So the administrative supports and the infrastructure that you need to support the team that's going to take care of the patients. So that infrastructure starts with a building. So I was hugely fortunate to have the support that we've received from the town of St. Andrews and from the philanthropists, the Dunn Foundation and others that have paid for the wellness center here in St. Andrews, is really the building block to what I've built on. Without that, we would not be nearly as far ahead as we are right now in our planning.
Yes, we should say for anyone watching at home, the town of St. Andrews was proactive long before what the province is doing now. I know it's a new government, but the province or the town was doing this even before the new government's plan was to give space for a wellness center in this very building. And that idea was to recruit doctors, and then along came Dr. Julie and changed many people's lives in this part of the world. So you're saying this building is the infrastructure, the building block from where you build everything else. But again, yes, the town deserves a great shout out for that.
Absolutely, they do. So that's the beginning, and then of course there's the funding that helps, you know, build the team, build the clinical, the computers, the blood pressure cuffs, all the things that you need to practice medicine to be able to, so it doesn't all have to come out of the doctor's pocket. I mean, certainly I did spend some of my own money doing this, but if there's access to that kind of funding, so we got that funding from the New Brunswick Medical Society and Health, have built something called Family Medicine New Brunswick, and the goal is to encourage physicians like myself to build primary care teams. So that foundation bit is, you know, having the building to work with, having the underlying infrastructure, things like, you know, an electronic medical record to be able to communicate between staff members, hiring the staff that you need to be able to make you more efficient. My husband Ray Taylor has an MBA, so we're putting that to good work. So he's the practice manager. He's done all the heavy lifting on getting us up and running with our new electronic medical record, getting things like e-fax put in place, so we're not using paper anymore. And yes, we're still getting paper from the hospitals, but we're working on that. But being able to scan things in, so I'm not touching huge stacks of paper that I can't bring home on a Saturday night. I can do it all on a computer. On a snow day, we can, you know, if no one can get into the clinic because there's 2 feet of snow, we run the office. We have VoIP phones that the town has purchased for us, which means that we can answer the phones from our home if we have to. So, and I can do, you know, virtual visits in person on the phone or on video through the new record. So all of those things make us more nimble to be able to. We don't have to cancel clinic on a snow day. We don't have to cancel clinic if I've got a child that's vomiting and I have to stay home and take care of her. She can be in her own bedroom sleeping, and I can still make phone calls and still kind of do my work. So this is all of the infrastructure of the base of the whole plan. So Family Medicine New Brunswick also provides funding to encourage family doctors to add more team members. What do I mean by that? So we've chosen to start with primary care nursing and a nurse practitioner. And so, and how do you find these wonderful professionals? Well, you teach, and word of mouth always helps. So Morgan Stevens was the first person that we have offered a job to using that funding. So she is a nurse practitioner graduate. So she worked with me in the clinic for her practicum and her clinical hours over the last year. We clicked. I thought she'd be a great fit for the community. She's from St. George, so she's a local person. She's a 7-year ER nurse, so she's got lots of great experience under her belt. She's a good human. She's fun to work with, lots of empathy. She's all the things that you would want. So we're anxiously awaiting the results of her exam. I have no doubts she's going to pass. She's a bright young woman. So as soon as that's all said and done, you'll have recognized, people who are in my practice will have seen her in clinic already as a student, but we're really excited to see her take on a practice and work in the clinic. What does that mean? It means that when I'm pulled away to the hospital, which will be more often now that our call group keeps shrinking, because that's not an option. All physicians that work in Charlotte County must work in the call schedule as hospitalists at Charlotte County Hospital. So the fewer docs we have, the more often we need to be there. So when I first got here, we were 1 in 8 weeks on call. We're now 1 in 5 to 6 weeks on call. So you got to think 20 to 25% of the time I'm away.
So,
that is a lot of time to be away.
Yeah, that's a part of the formula that I honestly haven't even thought about to make the problem of doctor shortages even more complicated, is that when we lose doctors, then that also increases your shifts at the hospital.
Exactly. So if I'm away at the hospital and I'm taking care of the sickest of sick people, I can't be in 2 places at once, although I try. They call, we try to do things over the phone as best we can. It becomes you're trying to manage 2 places at once, and it's stressful. And it's difficult because there aren't enough hours in the day. So having Morgan as a nurse practitioner in the office, when she's able to start prescribing and doing all the things that she'll be able to do when she gets her license up and running, is that she's going to be able to field most of that stuff. So she'll be working 3 days a week and building her own practice. But on the weeks that I'm at the hospital, she's agreed to come 5 days a week during those weeks. So the vast majority of the things that could possibly come in through the clinic that are urgent, that need to be seen, would be able to be managed by Morgan. And if something comes in that is beyond her scope of practice, then Dr. Drost in St. George is my family medicine New Brunswick buddy doc. So Coastal Communities Health Home, as you mentioned at the beginning, is the name of our family medicine New Brunswick Family Medicine Brunswick Health Home team. And so what that means is we chose that name really carefully, because the idea here is we're just getting started. My husband would say, no, she's going for a pivot. And so it's not, to me, not enough to create this wonderful thing in St. Andrews that we're building here and creating more access and more space for people to make sure that everybody gets a family doctor. It's being able to take that model and offer it to new graduates, new doctors that come to some of these other communities. So when Horizon Health decides to build something in St. Stephen, and we're trying to, while we're teaching and bringing in residents and showing them what a wonderful place Charlotte County is to practice, it's being able to say, don't worry, young doc, I got your back. I figured this out already. Here are all my workflows. Here are all the things that you need to buy. Here's the ABCs of how you're going to start that practice and build it the way I built mine. And you don't have to figure that out on your own in your first years of practice.
Kind of a wonderful, it creates almost a succession plan in a community that often fears losing. I know that there was a certain point in time recently where a huge chunk of our doctors were nearing retirement age, a very large number.
Yep.
And that makes you start to wonder, how did these new doctors get into the community? So this must offer another way to mentor people who might love this part of the world and want to come back, or like you and want to start a life here.
Exactly.
It gives you a chance to keep them and have them trained for that next generation.
Exactly. So what we built here, so Coastal Communities Health Home St. Andrews, that's me. Coastal Communities Health Home St. George, that's Dr. Cherise Drost. And then eventually, maybe St. Stephen, maybe Blacks Harbor, maybe Grand Manan, maybe whatever. The sky's the limit. If you have physicians that come that like what we've done, and we get support hopefully from Horizon Health to be able to get some of these things off the ground in other communities. I mean, you need a physician leader wherever you go. I'm the leader for St. Andrews. I'm, helping Charisse get off her feet and be able to, because she's brand new in practice. She's been there for 2 years now, I believe. So we're mentoring her along so that she can create what we've created over time. And then eventually, the first thing I did when I got here is I looked around and I'm like, where are all the students? There's no students in the hospitals. There's no medical students, nurse practitioner students, family medicine residency students. Like, how do you attract succession if they never get to see how wonderful this place is, right? So the first thing I did is call the Dalhousie and Munn and say, sign me up, send me your students. So we have medical students, we've had family practice residents come through, we've had nurse practitioner students, and so that's really how we're getting the word out to hopefully be able to, build this.
How exciting. And I do know so many young people studying nursing or going on to medical school who would love to come back to this part of the world. So it's wonderful they have this model. I think it's also wonderful that you have expansion plans. What does that mean for a doctor who might be watching in another corner of Charlotte County who might be interested in either doing a similar model or joining on to coastal communities?
I'm going to look right in the camera and I'm going to say to anybody listening or anybody who knows someone who has been accepted to medicine or even that they're thinking of medicine as a career, I'm happy to talk to high school students. I'm happy to talk to people that are already kind of in that stream and want to apply to medicine. If you are a Charlotte County person and you want to come home and serve your community as a physician and that is your dream, we want to talk to you immediately. Don't wait until you get to, you're a family medicine resident and you're starting to pick your practice site. Too late to the party. Like, we need to identify these young people that are interested in a career in medicine so that we can start having those conversations. And what I would say to other municipalities is take a page out of St. Andrew's playbook and support that initiative. St. Stephen has started having conversations. I've heard about through CCHCO. That's how I know these things, because I follow you on Facebook. They're starting to talk about incentives and to be able to support those. Talk to the med students. Just that last article that you guys just through St. Croix. That's what we need. We need these young professionals to feel like they're welcome in Charlotte County and that they won't be alone when they come to practice. And we have to start acting like we want them and that they're going to be supported when they come here.
Oh, absolutely. My favorite thing about Charlotte County is that our community is the type that finds its own solutions. Sometimes you can find you're sitting around waiting and the best thing you can do is get up and just solve it for yourself. So you are so inspiring to have here today. I'd love to hear a little bit more about how this model will increase patient loads that you're able to take on.
You bet. So I'll preface that by just announcing that on top of Morgan Stevens, who's the nurse practitioner graduate that is going to start working for us very soon, we've also hired a full-time RN. So Gabrielle Cooper, who's been living in Shamcook for the last 7 years, she's local. Oh my God, what a diamond in the rough we found there. So Morgan had been working with her in the emergency room and she says, Julie, have I got a nurse for you? So connected with Gabby and we've hired her on. She's started just 2 weeks ago. And so the idea is that all of that, remember when I told you at the beginning, I just don't have time for prevention. I do the best I can. Exercise is medicine. Go be more active, and off I send them. Like, that's not enough. Like, you need someone to dig in and decide, like, what are the barriers? What do you need? What's the supports that you need? So Gabrielle is really going to be instrumental in extending my reach to be making sure that it's not just the tasks taken out of my schedule. It's a nursing approach to whole person care, so that we're not just talking about diseases, we're talking about prevention, we're talking about supporting people when they have a chronic disease already. How can we just, beyond just prescribing medicines, what can we do to help support people? So she's going to be doing a lot of that. She's going to be in charge of the flu shot clinic for my practice next year. You wait, this young professional is going to hit the ground running, and people who've met her have already fallen in love with her. She's amazing. So that's going to broaden the ability to do more. So here's the big announce. Obviously, we've already talked about Morgan and her ability to take on a practice once we've received word from her licensing board and all of those things. Zero concerns, it's going to happen. So once that happens, we've already been in touch with 811 and we've received the list for our area. So we've chosen a catchment area to start with of E5B, and I know that's a bit of a delicate point because obviously all of Charlotte County needs doctors, but we've chosen to do that because we do receive an enormous amount of financial support from the town of St. Andrews, and it seems right to start there. Obviously, as we continue to grow, we should be able to move past that, but that's where we're going to start from. We've already started making phone calls. So those of you who are on the 811 list, do not leave your phone unattended. You may be getting the call soon because we're reaching out. We've already started making phone calls and we hope to take on an extra 400 patients.
Oh my goodness, that's so exciting. It really is. I mean, that again, another reason for everyone to answer your phone when you hear phone calls.
Yep.
But I wonder too, what does it mean down the road? I think that one day it would be so great to have a walk-in clinic that didn't require you going to the hospital. And I find that, yes, if you have to go to the ER and it's something you know you could just go for a walk-in appointment, it would be great to, or not walk-in appointment, I guess is a bit of a oxymoron there. But would there be potentially down the line the possibility of also having a few walk-in hours available?
So I'll tell you, in terms of the way that we run my practice right now, and already we're noticing a difference just having learners in the clinic. Like when I have a family medicine resident in with me, when I have a nurse practitioner student with me, it increases my ability to see more patients. So my access is much improved. Like unless I'm away for the week, and now that's no longer true because now we'll have Morgan covering, but excluding in the past year, if I say, you know, what's been happening before that we're going to change, is excluding the times when I've been away either on a holiday, away at a conference, or away at the hospital, our access generally, when you call, you should be able to get in within a few days, if not that day. So walk-in becomes, you call, they say, no, come in at 2 o'clock. We've extended the hours, so, you know, health doesn't give away money for free. That's normal. So in part of the funding that I've received to build this team of mine, one of the deliverables is extended hours. So please don't feel sorry for me. My hours are now 7 a.m. to 3 p.m., Mondays, Tuesdays, Wednesdays, and Fridays. And then on Thursdays, we work at noon to 8 p.m. And what that means is that for working families who can't take time off work to bring their babies in for vaccinations or whatever the reason they're coming, we have hours from 7:15 in the morning. Give me 15 minutes to get my coffee and my computer started, please. So 7:15 till 3 p.m. in the afternoon. So we have that morning time. And then for people who just can't come during the day at all, we have that until 8 p.m. time on Thursdays. So that's creating that room. And we always save everyday spaces for same-day appointments. So I don't consider that walk-in because it's same-day access for my practice. Now, that, of course, that's for the rostered patients of the practice. Have I been known to take off a tick when somebody just walks in, or some lady fell in our parking lot at one point and it needed some wound care? Of course, if we can, we will, obviously. But the more we grow this and the more we have staff, the more we can start looking at things like walk-ins and the ability to absorb more of kind of that need. But the bigger goal here is to have enough doctors in all of Charlotte County so a walk-in's not even necessary. You should be able to go to your family health team home and to be able to have it planned in such a way that when the main doctor is away, there's someone there covering and you can see your doctor. You don't have to go to the emergency room unless it's a life or limb thing.
And to see a place that you call, that's my family care home would be, I think, for a lot of people, just special enough.
Yeah.
From having been able to implement this before coming to New Brunswick, how have you seen it shape a community for the better in terms of people's just sense of relief, even knowing that they have this care available?
Oh, absolutely. I think, and as you start to get to know people, I mean, it's always in the beginning, first appointments, we're learning to trust each other and all of that. But there comes a point where people just know that when they call or they show up in the clinic, we're going to take care of them. And the more staff that I keep adding to the team, the better I can keep that promise. I mean, can we 100% of the time meet 100% of the need? I mean, that's impossible. You can't promise that. But the more that we create these teams, the more that there's not just one person. When you leave the burden on one person, that one person gets sick, that one person is at the hospital, that one person is drawn away, I'm maybe at a home visit, I might not be on site. But if there's nurses and nurse practitioners and learners and other people that are able to answer the call, then I think we're I'm not surprised. Charlotte County is full of warm-hearted people. I've received zero pushback as I start to announce and roll this out to people. They're just super excited that I'm not going to burn out and leave. And I've never been so welcomed and cared for by my community of patients. People care about I had knee surgery a couple of years ago, and I limbered into clinic after having a meniscal repair, 4 days later on my crutches, still running clinic. And I got scolded by my patients. What are you doing here? I'm like, people need their prescriptions. I can do that on one leg. But if I can take time and actually have vacation with my family and use some of these initiatives to make things better. Oh, I haven't even talked about my AI scribe. Like, don't even get me started. All my charting gets done by AI now, assuming patients agree to it in the clinic. And so I'll tell you who the biggest fan of that is. It's my 11-year-old daughter, Isabella, because that means that mommy's not in her charting chair as often, as she calls it. And so when I go home, my charts are more done. Not to say they're always done, but I do some work at home when I get home. But I have a computer; I can do it in my jammies, in my own environment, right? As opposed to all of these things are making my life better, so that I can stand the test of time and be here for years to come, and not be exhausted and burnt out and curled up in the corner wondering, oh my God, what have I done?
Oh, wow! If I could give you a crown and make you an official Charlotte County girl, I think you have earned all the stripes necessary. I can't believe this is something you've been able to implement in such a short period of time. Thank you for doing it. Please come back anytime and we can discuss how it's going. I think it's also important to keep the word out that other doctors could join the charge and be a part of this way to innovate healthcare in Charlotte County. Thank you so much for being here, Dr. Julie, and I hope to have you back soon.
I'll be back. Thanks.
My guest today has been Dr. Julie Levesque-Taylor of Coastal Communities Health Home right here in Charlotte County. I'm Vicki Hogarth. Thank you for watching Southwest Magazine.
Southwest Magazine is a news and public affairs production of CHCO Television.